A university in Nevada has created a new program to treat families in underserved communities of color.
The program is known as Genesis. It matches students and health practitioners with families to offer them health and social services in their own households. Roseman University's College of Medicine launched Genesis on Wednesday. It seeks to address and dismantle barriers to health care faced by uninsured, low-income, or undocumented families in the southern region of Nevada. Genesis is modeled after a similar health care program at Florida International University.
Yeah, Nevada is plagued by significant health disparities. For example, chronic diseases, including heart disease, stroke, and diabetes, that present some of the leading causes of death in the state, are most often found among people of color, including American Indians, Asian Pacific Islanders, and Black people of non-Hispanic descent. So joining us now for more on this is Dr. Pedro Joe Greer. He is the founding dean of the Roseman University College of Medicine. Dr. Greer, welcome. It's great to have you with us. So please excuse my bad pun, but I am eager to know, what is the genesis of Genesis? How did this program come to be?
Well, actually, at Florida International University is where we started this. We were part of starting that university there. And you have to look at yourself as a profession, as an individual, when you have these disparities and so many people suffering. And we as a profession and as medical educators, we got it wrong. You shouldn't have these disparities in this country with the wealth that we have. So instead of putting a round peg in a square hole, why don't we figure out a system to prepare the future workforce to be able to take care of all populations? Remember, medical students come from a pretty affluent family backgrounds, with 81% coming from the top 2 quintiles of American income. Their exposure to poverty and people in vulnerable communities is minimal. So what Genesis started to be was, how do we get to the most vulnerable of our society and give them the care that they need, understanding that 80 to 90% of all diseases have a non-biological cause. They're called social determinants, and those need to be addressed.
Dr. Greer, the home health care aspect is fascinating. Can you discuss how students and nurse practitioners will treat patients within their own homes?
It's not just medical and nurse practitioner students. It's also social work, legal. You need behavioral therapists, et cetera, going through there. And the way you do that is the households are referred to us by our trusted partners. Why? Well, if you have a not-for-profit or a faith-based organization, or say you have a small little store, you're the first one to notice that somebody's sick or not doing well. But you have to understand that that individual, if they're hourly, have no benefits. So to go to a doctor means you're going to make 20% less that week, which is a horrible choice for individuals, plus what they got to pay for the visit, plus what they have to pay for the prescription that's been written, as opposed to going to a household where somebody might be working 2 or 3 jobs and make it convenient for them. We have to look at the system that we have and say, what is wrong with what we're doing? And how can we improve the lives of those that are the most vulnerable? And COVID pretty much ripped the roof off of society and said, wow, we have a lot of disparities. And the other thing, too, is in the Black and brown communities, anchor institutions are not well trusted. We have never really done anything. I mean, what do we do in medical school and research? We go in, we take your blood, we take your story, we take your tissue, but what do we give you back? You've given us something very personal. So it's going in there. And the medical students, when they go into the household, are not allowed to ask, how do you feel? They have to ask, what is your most urgent need? And the reason for that is when you come from a well-to-do background, you don't understand the realities of, wow, I got to choose between my insulin and dinner, or housing, or somebody has an addiction problem in the household, or a mental health issue in the household, and how do we get care for them?
Wow.
And all of these things interact.
That really paints a stark picture. What is your most urgent need? Wow. So Dr. Genesis currently includes students from 6 different health practices, including medical, nursing, and dental. How many patients in Southern Nevada do you believe they will be able to treat each year? And are there plans to eventually expand the program both there in Nevada and perhaps beyond?
Oh, yeah, 100%, because we also want to get to the rural communities and what they call the frontier communities here, out here in the Southwest, which have even less access to health care. Well, for every household we have, because we take care of the entire household, you just can't take care of a disease. I'm a liver specialist by training. But very interestingly, I've never had a liver walk into my office. It's always a human being, and that human being is also surrounded by family and other aspects that go around it. So when you take care of the household, it's not a patient. You take care of the entire household. And why is that? Because it all interacts, and it becomes important. And everybody in that household is just as vulnerable as the next person. And if you're taking care of a patient, but the head of the household gets sick and they cannot bring in the money, that's going to affect everybody in that household. So what the student's going to learn is two things. Number one, medical school, your rotations are generally 6 to 8 to 12 weeks. Well, that's not a reality. When you become a physician, you're going to take care of somebody for years, hopefully, or maybe even decades. So here, they're actually going to be doing all medical care for 4 years, longitudinally looking how the family progresses, what they can do, what are all the different issues that are in there. It's not just about coming to my office and I write you a prescription. It's about going to their home. And what that also does is it changes the power differential. So no longer is the doctor in their ivory tower being called Dr. So-and-so and you calling somebody by their first name. Now the student learns humility, learns empathy, learns compassion. And those are the essential virtues that we need to have. And you can do that in a program like this.
All right. Humility and compassion goes a long way. Dr. Pedro Greer, thank you so much for your time.
Amazing work you're doing there, Doctor.
Well, thank you very, very much. It's a pleasure to meet you both, and thank you for inviting me.